Hey, Kaylin, we're having a little trouble with audio.
So,
all right. Well,
we're not able to hear you, Kaylin. Can you hear us?
Yeah, we can't hear.
No, it's good for like a couple seconds and then went out.
Yeah.
Mm-hmm.
I can hear everyone but Kaylin.
Vicki, I can't hear you.
Could we ask Kaylin to log off and then log back on?
Yeah, call back in, Kaylin.
Yeah.
I can't hear anybody.
I can hear you, Nina.
I can hear you, Nina.
hey, everyone, we're having just a little bit of technical difficulties. If you'll give us just 1 second, we're going to try and get it all fixed up and ready to go. Thanks for being here today.
Mm-mm.
No.
It happens.
Mm-hmm.
Technology.
Always technology. If our kids were playing a game, it would work perfectly.
I know.
Of course. That's probably why ours isn't working right now.
That is absolutely why it's not working.
Can you hear me now?
We can.
Yes. Yes, we
can. Awesome. Okay. I'm using my phone for audio, so hopefully this works a little bit better. Well, welcome, everyone. Thanks for joining us today. I'm going to start completely over from the beginning in case you missed everything I was saying. This month is Minority Mental Health Month, and we are using our platform to help elevate voices, to listen and better understand, and to support the unique needs and range of experiences of underrepresented racial and ethnic groups. As a health organization, AFSP is dedicated to addressing the mental health and suicide prevention needs among minority populations. We know that there's much work to do, but today we are making progress by speaking out about mental health and people of color. My name is Kaylin Fisk, and I will be the moderator for today's discussion. I'm a wife, a mom of 3, and owner of 2 small businesses in Fort Worth, and the reigning Mrs. Texas. I became involved with the American Foundation for Suicide Prevention in 2016 when I became the chairperson for the first Out of the Darkness Walk in Fort Worth. I did this in memory of my father. I joined the board of directors for the North Texas chapter in 2017, and I continue to serve as chairperson for the Fort Worth Walk. As a Nisei generation Japanese American, I'm familiar with the unique challenges that varying cultures face in regards to mental health and suicide. With us today, we have a wonderful, diverse group of panelists from across Texas. And I'd like to begin today by introducing each panelist and doing a quick mental health check-in with them. When I introduce you, if you don't mind just like waving to everyone. Vicki Saldana is a full-time mom for her 2 young children and is married to an essential worker on the front line. She has been actively volunteering with AFSP since 2016 after the loss of a close relative and friend. She has been the Austin Walk co-chair for the past 2 years and serves on the board for the Central Texas Chapter. As a South Asian female, her point of view on mental health has provided unique challenges in her community. Vicki, how are you today?
I'm doing well, thank you. Feeling a little better, you know, every day is different from the other.
I hear you on that. Laura Gold works for the Texas HHSC as Suicide Prevention and Project Aware co-coordinator. She has led several suicide prevention initiatives, including but not limited to Suicide Care Initiative and Zero Suicide in Texas. Laura is a clinical social worker, co-author, presenter, and a lecturer with over 20 years of experience working with children, families, and the community. Laura is a wife and a mother of 2 teenage boys. She joined the Central Texas Board this year as board president. Wow, thank you for being here, Laura. How are you today?
Thank you, Kaylin. Feeling pretty good because I have vacation next week. So I'm actually doing pretty well right now.
Good. Marcus Slade is currently a staff sergeant in the United States Air Force and has been serving for 14 years. He sits on the North Texas Board of Directors for AFSP and co-chairs the Taylor County Walk with his wife, Patrice. And sometimes their 5 kids help too. His passion for suicide prevention started after his children lost their biological father to suicide. After working with AFSP, he began to openly talk about his own attempt in an effort to support those who struggle. Hi, Marcus, how are you?
I'm good. I'm off work to be here with you guys. So anytime you get off on a Friday early is a great day.
I have felt really good all day knowing today is Friday.
The best day of the week.
Absolutely. Nina Enriquez is a faculty member at the UT RGV School of Social Work. She has over 13 years of experience working with hospice and palliative care. For the last 6 years, she has specialized in the field of grief, loss, and bereavement, working with Latinx survivors of suicide loss. She is currently working towards achieving her doctorate in social work with a concentration to reduce social isolation of Latinx survivors of suicide loss and increase help-seeking behaviors. Sorry, I stumbled through that. Nina is married and she serves on the South Texas Board. Hi, Nina.
Hello.
How are you?
I'm doing good, thank you.
Good. At a time when we are all experiencing so many different types of loss as a result of the pandemic, loss of loved ones, loss of routines, loss of stability, loss of social interaction, many of us can find ourselves experiencing a form of grief. Nina, can you talk to us about grief as it relates to COVID and what we have lost as a society through this pandemic?
Yes, thank you, Kaylin. So I think we've all become very much aware and we all have been impacted on being socially isolated from families. As a Latina, I come from a very large family and we have a tendency to see each other very, very often. So not having that closeness has been a loss. You know, that loss of the relationship, speaking to somebody on the phone versus talking, you know, seeing them face to face is very different. We've had loss of our normal routine. We've had loss of our freedom. We have loss of trust, loss of our safety, and we have a tendency to grieve that. I think many times people don't really understand grief and the impact that grief has. But in reality, grief is a natural and normal response that we're going to experience to a loss. Grief comes first before we become depressed. And I think that's very important for people to be able to understand, is because many times people may feel like, oh, she's depressed, when she may be actually grieving. And there's a lot of misdiagnosing that goes on as well. In the Latino community, we have a tendency to think that when we demonstrate or we express our feelings of grief, we may be seeing it maybe as a sign of weakness, or maybe somebody is crazy, loco. Okay, it's what we say in Latinx. But in reality, it's grief. You're sad. You're going to be sad. When there's this change of routine, you're going to be sad. Personally, I experienced a lot of anxiety come in March when we had this change of our routine, having to work out of home and not being able to see anybody. I'm a very social person. So not being able to be around people and staying home was very difficult. So it does impact us emotionally, mentally, physically, and even spiritually. So, but bottom line, what I really want people to understand is that grief is very natural. It's normal to grieve. There's nothing wrong with that. And I don't want people to assume that, oh my gosh, I shouldn't be feeling this way. What are people going to think because, I'm not able to function, I can't think. When you've lost something, you're going to experience that. It's natural to be able to feel that way. There's nothing wrong with you not being able to function at the moment. And so grief comes in waves, and you see it, you go through different triggers throughout life. Grief never goes away. It does get better, but it doesn't go away. And loss, like I mentioned earlier, loss could be anything, not necessarily just a death, but it could be a loss of your health, a loss of a lifestyle, loss of a friendship. And so you grieve that first before you actually may become depressed. So thank you, Kaylin.
Thanks, Nina. While we are facing loss and constant change and uncertainty through this time, Laura, how can we safeguard our mental health?
Well, I think, first of all, like Nina was saying, I think acknowledging that we have this grief and acknowledging that this is a very unique situation that we are all experiencing. Usually when we have a natural disaster, it's usually concentrated in one place. And one of the things we can do after a disaster is get together, right, and support and help out and so forth. And we can't do that. And this is not just in a special area. So I think definitely we need to be able to acknowledge that we are all grieving this loss. We are all going to have different experiences, and that even within a household, people are going to grieve this at different levels, depending on their ages, depending on how extroverted. I work in schools and with the school districts, and one of the things that I've heard is that for some kids, they have found this really good for them because they're introverted. They've been able to do this. But we have so many other kids who may be extroverted and just enjoy being there at school, meeting with a teacher. I know my sons are like that. And it's very difficult. It's been very difficult for my youngest son to really feel like he's part of anything right now. So I think definitely acknowledging and then going and seeking help. And it doesn't have to be a professional clinician. It could be a friend. It can be your pet. One of the things I can honestly say that's helped me through this time is being able to spend a lot of time with my elderly dog. She's about to be 15, and I would have never been able to experience any of this had it not for me having to work from home. So that has been very helpful for me in my support. And so I think finding those ways. I know I've heard lots of people saying, this is the first time I've been able to exercise so much. I don't have to get up and get ready and drive and anything like that. So I think acknowledging it, making sure that you're in touch with others, whether that's through a phone call, whether that's through Zoom, as we all are experiencing nowadays, and even other ways, even if it's just through a letter that we write to someone. I think there's very many ways, but acknowledging that we're all experiencing this. And I think in that kind of collective way, we can be resilient as well.
That's really helpful. Thank you, Laura. My father was a Japanese American born in an internment camp during World War II. he faced racism and inequities growing up that contributed to his mental health struggles. And because he belonged to a culture where mental health was very taboo to discuss, he had tremendous difficulty recognizing his struggle and seeking help. Vicki, as a member of the South Asian community, have you had to overcome stigma within your culture as it relates to mental health?
Yes, absolutely. Like you said, mental health issues are a very big taboo in the Indian culture as well. It's like your family has to keep things a secret. It's a topic that's never discussed. But I feel like the first thing that needs to be done to overcome the stigma is to educate members of the community about all of the misunderstandings that are surrounding mental health. You know, there's a lot of social pressure to conform. The Indian culture tends to block out any controversial issue. It's viewed that people with mental health issues are not valued or you're considered a weak person. I just feel like having that uncomfortable and open conversation, especially with our older generations, within our family can make a big difference. We have to teach to show compassion instead of gossiping about them. And personally for me, to overcome the stigma, I'm starting to openly talk about mental health to others and how important it is. It's just really all about starting that conversation. I feel also like the earlier we talk to the younger generation, the more they won't feel ashamed the older that they get. By saying to a friend or a family member, hey, I'm going to see a therapist to talk about my mental health, maybe that comment right there will help them to not be afraid. I guess, you know, if you go to a doctor, if you have back pain, you want to go see a doctor. Why would you not go to a professional, or like Laura said, you know, even a friend or whatnot to talk about your mental health? There's a big lesson that I have learned coming regarding this, and that I would love to teach others. It's to not ignore a mental health issue. If you see a family member or friend struggling with it, if they're showing the signs, it's okay that they're feeling this way, and just to reach out and show support, because together, collectively, we just can't brush it under the carpet anymore. And I am sure that this is something that every other minority group can agree with as well.
Absolutely. Thank you, Vicki.
Can I?
Marcus. Sorry, go ahead.
I'm sorry, I just wanted to piggyback on what Vicki was saying. You know, I think it's very important what she just finished saying. You know, many times we focus so much on what other people are saying, and that prevents a barrier for us to be able to seek help. I know one of the things personally that I've had to do in my life was that I had to be able to just tell myself that I had value, that I was important. And I have others that depend on me, but I couldn't take care of anybody unless I took care of myself first. And it's very scary when you're going to tell a family, especially in the Latino population, you're going to tell them that you're going to go and seek help, psychiatric help or psychological help. It's very scary because of the responses that you're going to receive. But at that moment, I made a decision that it didn't matter what anybody was going to say, because I had to matter. And I think bottom line, that's where we need to get to, is we need to tell ourselves that I matter. It doesn't matter what anybody else says. It has to matter what I say. And I just wanted to share that along with Vicki.
Thank you for sharing that, Nina. Anybody else want to share?
Just one thing to add to what Nina was saying is even in the Latinx community, we also tend to want to go spiritually, to seek spiritual support as well. And I think people need to understand that you can have both. It doesn't need to be a choice. You don't have to say, well, I can't go to the priest because I'm going to go to a therapist. You can do both, and being able to feel comfortable in that regard. I would say, though, that that's why it's so important for us to be able to reach out to our community, our faith-based organizations, because they really do want to know how to help somebody who may be experiencing a mental health crisis. They really do want to know what the steps, how to ask questions, how to refer them to specific resources. And I think that's part of also the destigmatization, is to be able to educate, to be able to bring that out to other groups, other organizations that may be providing some type of support for people.
Great points, Laura. Marcus, can you tell us about your experience as an attempt survivor in the Black community?
Yes, it's very interesting that, like, hearing everyone talk, the first thing that comes to my mind is the stigma that comes about before you even, I guess, say anything to anyone. So normally in my community, you have a tendency to hear about others' experiences, and it's kind of like a negative, like someone else lost their life, and the way that they speak negatively about the person and what they were going through, like, oh man, how is it? How did they get here? What's wrong with them? It's always a personal kind of thing. It's never, this could happen to anyone. And I actually started my, I guess, journey with losing my friend who was also a Black female. And when I would tell people of the importance of like how happy she was and how I would never think that there was anything wrong, it was kind of this still victim blaming of like, well, what was wrong with her? Something, it had to be something. And this one person was off. And I took a lot of offense to it because I was like, well, I know them. Like, you're not talking about, you know, this person that didn't know how to handle things. You're talking about a well put together person. I would have never checked on them myself. I didn't know anything to do at the time. And so then I remember myself having to keep talking about it and what I went through and why I was embarrassed myself to say it, because I didn't want to hear, oh, well, you're scared, or are you a coward? Oh, you couldn't figure it out. You're not strong enough to deal with your own issues. Like, what's going on? And so in part of my advocacy, I started asking people what they thought. And when you would ask people what they thought about it, you get like a negative response almost always. And then I asked them what they think about me. And they're like, oh man, you're good. You're put together. And I was like, well, I attempted when I was in high school. And I was not so put together at the time. And they're like, oh man, something really bad must have happened. And I'm like, well, it did. However, something bad can happen to anyone. And we have this barrier because if I do have to tell you, I guess I use the example, if I have to tell you about the worst day of my life, the absolute worst day of my life, and you are a complete stranger, would I tell you? Would you tell me about yours? And so in that conversation, people are like, no, I wouldn't tell you. Well, that's what you're asking people to tell you about. So who wants to talk about that? Who wants to have that conversation? And then on top of it, in a community where it's frowned upon, or you know you're going to get a negative response. So now not only do I have to tell you about the worst day of my life, I have to tell you about it knowing you're going to respond negatively. And so I agree with Vicky that the education that one, it's all of us and not anyone in particular, that we have to teach compassion, because when we are speaking about certain things, we don't know who's dealing with it at that moment in time. So, because that's how I felt. Like in a room, they would be like, oh man, they're stupid, man. I don't know what's wrong with them. And I'm like, that's me. You're specifically talking about me today. You just don't know it.
Thanks for sharing that, Marcus. Would you like to expand on this a little bit further, given your experience in the military?
Sure. Ironically, in the military, it's kind of the same, except for you have a lot of agencies, like you have the helping agency and you have the places to go. However, you sometimes don't feel you have the time. Like, we're mission first. So, you know, deployments and job and keeping everything going, you almost feel like you're letting your team down when you take a break. So do I take this time to take a break and say that there's something wrong? Should I do self-care at this moment, or is that selfish? And then you have a thing where we blow by it so fast. Like, we're talking about it here, and it's almost like you can fix it. Because I mean, any service, any branch, we kind of fix things. It's broken, we fix it, you move on. This is ongoing. Like Nina said, like the process, I have a trigger. I have trigger all the time. And I've just learned to open up to my wife about the triggers that you have. So just because I'm in the military and I'm going to get up and I'm going to put my uniform on and I'm going to do exactly what I need to every day, I still have to find ways to say that I'm triggered today and that I need to take a break. But when is that break? And I had to do the same, I matter, and say, today is my day. I need a break. Hey, supervisor, I can't push through today. And so it's very similar, even though it's not a negative response. It's negative in the sense of the time isn't always as allowed to heal or to go through, or there's not necessarily a pause button on the mission for you to take care of yourself. And even though it's getting better, we can do so much better.
You know, I drew a weird parallel between your experience in the military and mine as a mom. Because as a mom, you are the fixer. You have missions. You are taking care of the family, and oftentimes we don't stop to take care of ourselves. We're supposed to be the strong person in the family and keep all our kids going and the positive person. And so when you were speaking, I could really relate as a mom to your experience in the military. I know it's completely different, but I found some
really
similarities.
Because even as a dad, I recently ruptured my Achilles, and as a dad, that was one of my losses, like the ability to be dad. Like if it's too heavy, dad will get it. Like anything that, almost like mom needs help, call dad. And, dad's like, if mom couldn't do it, dad is definitely going to be there. And I was not that guy. And it was like, man, what is wrong? And it feels a lot like that. Like I just started walking, and I literally post about happy to be walking, to regain that part of my life back. But during that time, that loss of like not having to be that person, it's the same, like that feeling you feel. It doesn't matter how it comes. The feeling is the same. And I think that that's what people fail to realize the most. Like, it doesn't matter what stemmed it. You feel the same. And that's how we're all here and understand and in agreement, because we all have felt that same pressure, that same loss, that same negativity that makes you want to correct something.
Absolutely. Thank you so much, Marcus, for sharing all of that. And thank you for your service. While we recognize the challenges and struggles of essential workers, oftentimes the toll that is taken on the families of those workers is overlooked. Vicki, as the wife of an essential worker who has been working on the front line through this pandemic, what advice do you have for families of essential workers who might be feeling overwhelmed?
So being married to a doctor, he's in and out of hospitals all over town. It definitely has added to my anxiety of what I already have, knowing about COVID-19. But some factors that have helped us as a family to get that when we are getting overwhelmed is just to have more patience and have communication. Most importantly, showing support. It's so important to show gratitude for our essential workers right now. It's such a hard time for everyone in the entire world, but especially for those on the front line, and their partner community is so vital for us to overcome this. So shining light on the essential workers. If people are overwhelmed, give them a reason to focus on their why, their purpose, focus on the greater good. And if they feel like they need help, to reach out. I also feel like, on the other hand, you're worried for them, working out there, but you also have to remember to take care of yourself. What are some things you can do for your own mental health? For myself, I connect with my family on FaceTime, or I catch up with friends on the phone, or simply just like paint my nails. I have to focus on my own needs, because life it is really overwhelming for everyone. And we have to remember to give ourselves some grace, because we're human, and at the end of the day, we're all in on this together.
That's great advice, Vicki. Thank you so much. Laura, as an essential worker yourself, can you offer some advice to other essential workers or families of an essential worker that might help them through this time?
Well, I think definitely what Vicki was saying about giving yourself grace, and also making sure that you're taking care of yourself. I think Nina said that also, that you can't take care of anyone until you can take care of yourself. And it's not being selfish. It's really knowing what you need to take care of yourself. It could be something like, exercise. We always think of the usual things, right? Exercise, yoga, things like that. But, I remember at the beginning of this pandemic, I was fortunate enough to be able to still keep my job and work from home. But for the first month, I barely changed the clothes I was wearing. I'd wear one t-shirt, one pair of pants, I'd have my glasses on all the time, no makeup, no nothing. And it finally struck me after about a month or so, I was like, this doesn't make me feel good. What's going to make me feel better? And it was getting up and putting on makeup, or thinking I'm going to wear this today instead of that, and just kind of going through those motions. Even as easy as just fixing your hair, can be a big thing. And so it's really about those little things that matter in order to be able to take care of yourself. I think being open, being patient, knowing that sometimes we may want to help somebody, but they may not be ready to share, but letting them know, I'm here for you. If you just want to sit here and be silent and I'll hold your hand, that's fine. If you want to talk to me about something that's happening, that's great. Just being able to be there. And if you feel like you can't do that, knowing that there are resources out there, right? Like the National Suicide Prevention Lifeline, like other kinds of resources that we know that people can reach out to as well. So I think being able to have those to be able to help somebody is really important. But definitely making sure that you're taking care of yourself and that you're checking in with everybody. And it doesn't mean that they have to give you a whole, big explanation. It could be just like, hey, yeah, I'm not feeling too well. I didn't sleep too well. Okay, well, is there something we can do today then, to make you feel a little bit better? So I think it's just those kinds of simple things. Sometimes people think that it has to be something big or expensive, or it has to do with a clinician. And sometimes they are. And there's nothing wrong with that, of course. But sometimes we can just be real simple of those things and making sure that our friends and our family know that we're here, and that they also know that, hey, sometimes I might need some help. I might need to reach out to you. Can you be there for me?
Yes.
Thanks.
Can I piggyback on that? So this morning I had a conversation with my husband, and I noticed that he was a little distant this morning, and actually he looked worried. And I'm like, okay, what's going on? You're very different. And so he's also an essential worker. And, this morning he's like, it just scares me. It scares me, coming home and that, I may have it and not know, and then I'm going to give it to you. And, and he's mentioned that before, but he kind of like blew it off. But this morning, and I think it's because we experienced something personal, but this morning it really hit him, and it was like, let's talk about it. And so it's very true, Laura. What you just mentioned is that sometimes they need us just as much as we need them. And we have to give them that space, to be able to have that opportunity to share how they're feeling instead of because I was the type that was, okay, as soon as you get home, you're going to do this and you got to do that. And, it's like protecting. And I didn't realize that I was also causing some anxiety until this morning, when he mentioned it to me. And I was like, oh my gosh, here I was trying to protect all of us, but yet at the same time, I didn't realize how it was impacting him emotionally. And so, yeah, when I gave him that opportunity to just talk about it, it also gave me awareness about his needs, his fears, his concerns, and how we can work with that together. So it doesn't really impact us as much as, as it can if we didn't talk about it. So very true, Laura.
There's actually,
Laura, sorry, go ahead.
No, there's a couple things that I thought of, and the first one was about taking care of yourself. My wife is a person that probably will do way more than she needs to. And if you ever seen her, she's really tidy, and I always like, how do you do so much? But I use an example or an analogy of like being a battery and having to know what your percentage is, like on your iPhone or whatever it is, to say, hey, this is a warning. At this point, you have to stop helping and plug yourself in. Like we do it on our phones. Like, some people have the 20, no matter what, at 20, they're plugging their phone in, no matter what at 10. And then almost all of us plug our phone in or worry at 5, where you're like, hey, I can only do so much because my phone is going to die. And if we apply that same logic to ourselves, to at least have some checks to say, hey, at this point, I'm not necessarily okay, but I got a little more. But knowing that, hey, at that 5%, probably need to close all the apps. You probably need to shut down and do whatever self-care technique that you do. And then as far as helping people, I was in a position where like I've understood that you can't help everybody. It's not even your job. A lot of people ask me, well, like, how am I supposed to help everyone? Well, one, I don't have acronyms by my name, meaning I'm not a social worker. I just have life experience. But I can understand that if any of you ask me what's wrong with me, I'm gonna be more willing to open up because I know that you understand. Whereas if a perfect stranger, I'm like, I'm not talking to you. So what I have learned to do is when I see signs, I reach out to someone else and say, hey, Vicky, you might want to reach out to Nina because she may not talk to me, but she may talk to Vicky. And my helping is not necessarily doing the actual work, but letting her know or letting someone know to check in so that way they can see the signs. And last, when you talk about, I know for men specifically, and women may do it too. Obviously, I can't speak for women, but men do this thing where, like Nina's husband, we don't share what we're going through to keep you from stressing because there's nothing we can do. It as a natural like fixer. I'm like, oh, I could tell her that I'm stressed about going to work or whatever I'm stressed about. But if she can't fix it, she's just going to be stressed too. Now there's two stressed people. So I'm not going to tell you I'm hurting because then you're at home worrying about something neither one of us can control. So I know that it's great that you reach out and understand those signs because sometimes we want to know that we can lean on you or can ask for help, but a lot of times that help has to be offered specifically because we don't want to burden you. And with everyone going through so much right now, it's not that you don't want to share, it's just that everybody has enough on their plate to not feel like I want to create more of a problem by adding my burdens onto your already stressful, hectic day, especially for the moms that are staying at home with the kids. Like the last thing I want to do is complain about work because they're going to say, you left the house. And I'm like, you're right, I did. I didn't see them for like an hour and it was a great hour, but I'm never going to tell you that hour was amazing. It was nice.
Thanks for sharing that, Marcus. Nina, do you have any advice specifically for minority groups or persons of color who may be feeling challenged to seek help because of stigma, but they're feeling just very overwhelmed right now?
Well, I think one of the things, as I mentioned earlier, is first of all, we have to really do a look at ourselves in the mirror and tell ourselves why I'm worthy. What would be different of me today if I went and I sought help? What would change? What would be different? How would my life become better if I sought help? If I began to understand the struggles that I'm currently experiencing? What would happen if I began to work with the struggles that I'm currently experiencing? A lot also has to do with our positive self-talk, because when we're going through grief or even when we feel depressed, we do a lot of negative self-talk. And we need to be able to kind of shift that and look at ourselves. And like I said, and I'm being very honest, I personally had to go through this. I personally, I'm sorry, my speaker goes off sometimes. I personally had to, take a look at myself and tell myself, wait a minute, I have value. And I got tired of feeling this way. Even though I come from a very large family, there's that myth of, that fear of they're going to see me as crazy. And so then that's when the silence begins. But then it comes to a point where you have to be able to really tell yourself, there's more to me than this. And so I think the very first thing is that we need to stop saying the negative things, and we need to start talking more positive. The more that you practice it on a daily basis, the more you begin to believe it. just like the negative thoughts. If you keep talking negative all the time, you believe what you say. You believe what you say. So you have to be able to begin to practice, even if it's something minute as, it's going to be a good day today. I'm going to focus on a good day. It's going to be a good day. Well, what does a good day mean? And it could be something real simple. I'm going to sing one of my favorite songs to make me feel good. I'm going to watch a funny movie so that I can laugh. Okay, I'm going to go take a walk and just breathe in the air, that nature is giving us. It's a blessing that we have air to breathe. And I'm going to see that as a blessing. So it's these little steps that we need to start taking. But ultimately, it comes down to when we talk about the Latino population, is it's okay to be honest and tell somebody, I'm not okay. Regardless of what the response may be. We can't focus on the response. We got to focus on what we can do for ourselves to get that help.
Thank you, Nina. Laura, I recently learned that the state has a COVID crisis hotline. Can you share with us a little bit about the crisis hotline and maybe offer any advice that you have for minority groups or persons of color who might be feeling overwhelmed right now?
Sure, definitely. Well, the number that the state now has, so just a little background, we have 39 what we call local mental health authorities. There are community mental health agencies throughout the state of Texas, and they provide mental health and behavioral health services to all residents in the 254 counties. Each one of those, though, has their own crisis hotline. So when the pandemic hit, HHSC really wanted to be able to figure out a way to really be able to help everyone without trying to remember this number and this number. And they were able to get together with the Harris Center out of Houston and create one main hotline number for anyone wanting some mental health support relating to COVID. And it doesn't have to be related to COVID, but just to be able to have that there with just that one number. So they were able to have this number. It's 833-986-1919. And that goes to the Harris Center, but it doesn't matter where you are in the state of Texas. They can be able to help you to connect you with resources that are local for you. I think that's a great thing that that the state was able to do that. And I hope that we can keep that because it does make it so much easier if you have one place where somebody can call and then they can do what we call a warm handoff to your local resources. The other way people can also access resources is by dialing simply 211 and pressing option 6. Option 6 will get you straight to people who know about the resources related to COVID-19 as well. So I think that both those things are very important for anyone, whether it is an essential worker or someone who's supporting someone like that, or just anybody who may be feeling anxious or out of sorts regarding this time. Those phones are managed by people who have been trained in mental health practices and services, and especially the crisis support line that has mental health professionals there. So they're there for somebody to listen to. The other thing I wanted to say, to piggyback on what Nina was talking about, was I like to sometimes talk about when I'm, like, for instance, with my mom, is to tell her, if your back was hurting or you fell down, what would you normally do? And she's like, well, I'd call the doctor. The doctor knows, of course. And so I'd call them and get an appointment, and they'd be able to help me. And I said, well, you can kind of look at when you're not feeling good, when you're feeling anxious or you're feeling sad, that something's not working. So it could be the same thing where you'd want to call somebody that could help you through it. And just I try to make that connection to people a lot of times, that when we hear somebody who has just recently gotten a diagnosis of cancer, let's say, we all rush out to help and to support. And we set up calendars to provide food for the family, and we pay bills, or we run, errands, and that's great. We should do the same thing for anybody else who may be experiencing a mental health crisis. It's in the same realm. Somebody is at a loss, somebody is grieving, somebody is afraid and fearful for what they're feeling right now. And we should be able to respond at the same way with that support. So I think, it's just about if we can kind of make that analogy for people. I think that sometimes, we just want to make sure, because I think people always want to help. I think sometimes it's that fear of the unknown. It's the fear of I don't want to make things worse. It's the fear that if I say something, I might put it in that person's head, and those are all myths. We know that people who are experiencing a mental health crisis really are reaching out for people, and they may not be saying it verbally, but they may be showing it in different ways, and we need to be ready to be able to say, how can I help? I care about you, and I've noticed these things happening, and I want to know, how can I help? But definitely, I would strongly recommend that people reach out to that mental health support line.
So do you mind repeating that number for us one more time?
Definitely. So it's 833-986-1919. And so far, I believe since the end of March, the state has already received over 5,000 calls.
Wow. Thank you so much for sharing that resource with us. That's great information. We have a question from a viewer that I'd like to ask the panel. Does the panel have advice to people for starting the conversation on mental health with their families, specifically from the perspective of a minority? She said, they said, whenever I spoke to my own parents, the initial reaction when I tried to tell them about depression was, who taught you that term? As if it was an American term that I picked up as opposed to a real issue. What advice can you give our viewer about starting the conversation on mental health with their families?
If y'all don't mind, I can
Go ahead, Nina.
Y'all can pitch in. Working with the Latinx population, and because, talking about mental health is very taboo, and it is, again, that stigma, that you're crazy. So one of the things that I normally encourage people to say is that people understand symptoms. They will understand when you say, I feel very sad. There are times that I just want to cry. There are times that I don't even want to get out of bed. Before you even using the word depression, and that usually, well, what do you mean you feel sad? What are you sad about? What do you feel like you want to cry about? What's making you want to feel like that? What do you mean you don't want to get out of bed? And so the questions will then come, but when we start saying, I've been feeling very depressed, depending on some family members, especially in the Latinx population, when you say, tengo depresión, I'm depressed, it's like, oh my gosh, no. And also another thing, like I mentioned earlier, sometimes we're not depressed. We may be grieving. So, we have to be very careful also the use of the terminology. So this is one of the reasons that I normally always tell, people that I work with is when you go back and you want to talk to your parents, tell them how you feel, the symptoms, describe, paint that picture, because they'll understand that. Because everyone has gone through a phase where they have felt very depressed, they've grieved, maybe they've even felt depressed, but you first want to paint a picture with symptoms before you actually use that term. And that kind of creates a safe place for everybody. Okay, so that would be my advice, to her.
Great advice.
That's great advice.
Actually, so my wife, when she was trying to tell me about what she was going through and what the children were going through, being a person that's very compassionate and trying to understand, I had a difficult time trying to understand. And I know Nina said, hey, say you don't feel like getting out of bed. Feel like you don't, tell them all the things that you're going through. I feel like crying. I feel like not working. I don't want to get dressed today. I don't want to do all these things. The first response I would give was, well, you have all these reasons. I would literally give her reasons why she should. And until I went through my own place, I realized that's all that you know to say. However, I started explaining it differently to people. I know what's going right and I know what's going good. And I know. So almost like when you're having the conversation, letting them know I value my family, I value all these things. However, I'm still here. Like I still ended up in this place and it is how I feel. And I would give anything to change it. Because a lot of times I feel like people think it is this choice that you are here. Like if you wanted to, you could wake up happy. And it's like, no, I actually want to wake up happy and I do not know how to express it. So when you're talking to your family, that's the part. You let them know where you are and you let them know that you're trying, but you have not reached a solution and you are saying I need help, regardless of what term you want to put to it. This is where I am. I kind of know that I shouldn't be here, which is why I'm saying I need help. And like I said, for me, I was the person that didn't understand. And I really thought I was trying to do a good job of understanding. And until I went through it, I realized there was nothing you could do to help without kind of communicating better for myself and listening better.
Absolutely. Vicki, did you have anything to add?
I really agree with Nina. She was saying, like, paint that picture, describe how you're feeling. He or she was mentioning, when they talk to their parents, I feel like that's the best way to go about it.
Great. Thank you.
I'm sorry.
Go ahead,
Yeah,
Laura.
go ahead, Laura.
Okay, just real quick, I just wanted to say also, and it may be also, especially in the Latinx community, I think, the generational differences, right? So, that definitely plays into this.
Mm-hmm.
And if your parents, if you're the first generation or second generation, and maybe your parents haven't really acculturated or assimilated, I mean, that is going to cause some of that kind of disconnect. And so what I wanted to say is that I think we also have to remember that if they're unable maybe at this point to understand, I like how Nina said about talking about the symptoms, but making sure you know that there are other places, other people, other support services that you can access. So if you're a college student, I was just listening to a webinar yesterday, but if you're a college student, making sure you know what are the services there at the college or, or in your area, making sure that you have some specific resources that you can lean upon. And, definitely whether it's friends or it's something else, but being able to have that, because at some point, people, I think, families, they come around. It may take some time. And depending on, like I said, depending on those generational disconnects, it may take a while. I really think that, I know that for sure with just, between me and my mother and having to go through that, the way she saw things, the way I see things very different. And it took years to really, and I knew I had to find maybe some additional support systems, which I was able to.
Mm-hmm.
Well, this pandemic can create an obstacle for many people seeking support. Are there any virtual support groups that you can share with us that could be helpful to our viewers? Maybe for frontline healthcare workers?
I actually host a support group for survivors of suicide loss once a month.
Okay.
But they're for survivors. So I do host. I was thinking of it maybe starting. I used to do a lot of grief support groups. I haven't done one virtually, but it's something that I am considering, to be able to offer, especially during this time, because there's so many people that really are grieving.
Great, thank you. For information on free virtual support groups for frontline healthcare workers in Texas, there's a phone number you can call. It's 833-986-1919. Again, that number is 833-986-1919.
So
at a time when it, sorry, go ahead.
I just wanted to just say something really quick that I think that, I'd like to make it very clear is, when mental health is, and suicide isn't really so much, it really is a health issue. It became a pandemic a long time ago. It became a world pandemic. And the public health, actually became a public health issue. So it started with the health of an individual, but yet we focus it so much on that stigma that it's related to mental health, when in reality, first it becomes a health issue, just like cancer and diabetes. So you get the sniffles, you get back pain, you immediately want to go and see a doctor and get medication for that. Well, when we start feeling sad and we start having these symptoms of distress, we need to see somebody, because we may not, and going back to what Laura was saying, as far as the different generations, we may not have individuals who are going to understand us in the family. And so you also want to seek outside of the family for someone who may give you that information that you need, and then come back and educate your family to make them understand a little bit more. That's it.
That's a wonderful point.
And I think just one more thing, like we were saying earlier about that suicide is a public health issue, like Nina, I think, alluded to right now. It's same like when we talk about cancer or diabetes. And if we can look at it more in that light, then we can be able to provide information and support and education to many other people. I think that, once we can kind of give them that kind of comparison, that it's not something that should be put away in a corner or not talked about or kept secret, or feel like we're putting thoughts into people's minds, but that it's just like cancer, just like diabetes, just like these major, heart issues. We did so much work in trending down the number of people that die by heart disease. We can do the same thing for suicide as well once we start talking about it and knowing that there are various support services in place.
Well, actually, when you say that, the first thing that came to my mind was actually like COVID. And one of the things that's kind of scary about COVID is that you can't see who's sick. Like any one of us right now could be dealing with COVID. So what have we all learned to do with COVID? Well, the first sign of trouble, you immediately go get tested. And if you feel any of these things, you do this. So, I mean, it's literally to the point of, in the military, you sneeze and we're like, hey, go to the doctor just to make sure. Like, we're not even taking any chances. But we can't see it. And we treat it that way because it's something you cannot physically see. So we're overly cautious about it. Whereas the things that you can kind of see coming is, like more of the health issue. Like, oh, that's what's going on. We treat it differently and we know about how much time. Well, we don't know who's affected. Well, we treated suicide the same way, where you don't know at any given time who's dealing with it. And if you understand, I literally say in advocacy all the time, we're already on the team. We're already on the team of advocacy, and not necessarily because we want to be, but we have something to do because we were forced on the team from our life experience. We want people that have nothing to gain or understand from this to be like, hey, this is an issue. Like, we should get involved before you're on the team. Like, we want you on the team just because you want to be here. Because once you are where we are, you understand how powerless you feel and how much you want people to take this information, but no one can see it. So they react as though, oh, it can't happen to me. No, it could be you tomorrow. It could be you like tonight. Like, you have no idea when you're going to have a trigger, when you're going to have a moment, or who around you is going to have it. And you don't want to wait until that moment comes to then say, oh, we have to do something about this. No, we have to do something about it now. In some aspects, we have to put our mask on for suicide now so that we can prevent it instead of reacting after you're getting and taking care of people that are already hurt. Like, we know you're hurt now. It's too late.
That's a wonderful analogy, Marcus. I hadn't even thought about the COVID and just, thinking about it. Like, we're all like, one of us could have it. We don't know. The same thing about suicide. So if we want to be resilient about getting over this, then we need to be able to take care of ourselves. Definitely.
Absolutely. At a time when it's more important than ever to practice self-care and to be mindful of our mental health, I think it would be wonderful to leave our audience with some ideas of tangible ways to protect our mental health. I'd like for each of you to just give us 3 things that you do to safeguard your mental health. Let's begin with Vicki.
So one of the first things is getting enough sleep. I know we say that a lot, but my son is finally sleeping through the night, and I appreciate my sleep so much more now. Ever since COVID all started, I have stopped watching the news as much, and that has helped me so much with my anxiety. Like, social media and the news and just hearing all this stuff, I just know, I have to stay safe, whatnot. And then the third thing would be, might be kind of funny, but for me personally, is to have 5 minutes to myself, I will just give my daughter my iPhone and she can just take a million pictures of herself. I don't even care. I'll delete it. If I have like 5 minutes of silence, that's fine.
That quiet time is so important. I totally understand that. Nina, would you like to share next?
Breathe. Oh my gosh. So I'll just self-disclose. So I suffer from a chronic lung issue, and when I get sick with either allergies or when it rains, I don't like it when it rains. I get more sick with that. But my throat here has a tendency to swell up and it closes. And so one of the things that I had to learn was to practice diaphragmatic breathing, to just relax the muscles on my throat to allow me to breathe. When I started practicing that, I didn't realize the research that it involves on how it really can benefit you in so many different ways. And so normally I have my iWatch with me, but since COVID, I don't use it, but I have it on my phone. I have a breathing app that will remind me. So I do my breathing 3 times a day. I take 5 inhale and exhale, and I follow the app, and that has really helped me a lot in reducing my stress, but it also keeps my lungs, and my throat muscles healthy as well. And so just breathing, in reality, if you practice and you follow, you get on a YouTube and look at diaphragmatic breathing, you're going to really feel very differently once you start putting it into practice. It truly does help. And also, you put deodorant on, because I wouldn't. I just started using deodorant again. I did say I was going to self-disclose, right?
Honesty, the best policy.
Marcus, would you like to share with us next?
So one of the things I've learned to do, and for a while now, is be honest about how I'm feeling. And as tough as that is, I try to at least tell my wife, but I try and tell somebody, like, in honesty, like how I'm genuinely feeling, and know that it's okay, and not minimize that feeling of like, hey, I don't feel as adequate today. And like I said, going through a recovery surgery, there's a lot of times where you're like, man, I wish I could do what have you. Like, my youngest son wants to play football. He's like, Dad, you want to throw football? Dad loves football. Dad cannot play football with you because he will be hurt again, because he already has a hard enough time rehabbing. So no, son. But those moments where it does bother me and hurts my feelings, I try to be honest with myself. I also share. I encourage other people to be honest. So I share my feelings, kind of social media, to let people know, like, this is how I'm feeling. And I call it being transparent, because a lot of times when I was going through what I was going through, I assumed I was alone in this feeling today. Like, hey, I went to work and I didn't feel like being there. Like, I was pretty much faking it till I made it. And I hope that was okay. And a lot of people feel the same way. Like, I just didn't have it today. And so I share, and then I value every moment. Like, even though it's COVID, and a lot of people, it seems cliche to say that, but like, I get to see my kids. Like, my kids are here visiting. I have 2 older children that are visiting for the summer. I spent more time with them this summer than any other summer, because I didn't have to work. I didn't have to take leave. We watched every Netflix. I've seen every Disney movie. I know the words to things that I don't want to know the words to, but they all smile, and we have jokes. And I appreciate those moments, because without COVID, I would not have had this time. I would not have seen some of the goofy things that kids do or understood some of the things. So I try to value even the bad. Like even my Achilles, I was out for 3 months. That was 3 months that I was still at home that I wouldn't have had. So yes, it's an injury. Yes, it's negative. Yes, it's terrible. Please don't ever rupture your Achilles. Do your stretches. But I promise I value that time. And even though it was a negative situation, I think we forget that. So for me personally, I'm honest with myself. I'm transparent with people, and I appreciate my time as much as possible.
I think that was very important. What you just mentioned, Marcus, is, that looking at that silver lining, we don't always do that. And especially during a crisis. And right now that we're in a pandemic, it's like I mentioned earlier, we have a tendency to always look at the negative. And when you mentioned about it, blessing, that you've had, that you spend more time with your children, that's a very good example of how seeing a bad situation that we're experiencing, but yet something beautiful comes out of it as well. So I really liked how you said that.
Absolutely, that's great. Laura, what are 3 things that you do to safeguard your mental health?
Definitely. I was going to say the same thing that Nina said about the breathing. And I was on a webinar, because I've been on too many of them probably for work, but where they said if you can picture a rose and a cupcake, and it was something to teach students, but it was like you inhale the rose for the smell, and then you blow out the candle on the cupcake. And it's just that idea of just really focusing in on that breath, smelling the rose as much as you can, or whatever it is, and then blowing out the candle, and just something like that to really center yourself. And I've really had to have actually my timer on my phone, because if I start working, I can get really into something and my timer goes off and I know, okay, I got to stop. I got to get up. I got to move around. And I got to do that, and make sure that I'm taking care of myself like that. Definitely something that I've gotten better at is saying when it's 5 o'clock, it's 5 o'clock, because I think working from home, although it's good, it's not good. And it becomes very difficult to separate. So I have really done, my best to really say, okay, it's 5 o'clock. I'm going to spend time now with my family and my sons, whether, they want to or not, and we're going to all eat dinner together. I have a 17, almost 18-year-old and almost 13-year-old. So, yeah, it's hard to get them to talk or watch a movie. But anyway, yeah, so that's some of the things that I do, definitely those 2 things. And then I think just trying to enjoy when I can, to watch a show that's funny, that's lighthearted. I tell my husband, it's like sometimes I don't want to deal with, I definitely don't watch the news, because that's not going to make me feel better. I know I need to know stuff, and I'll keep up with the news, but it's to see something that's just good and lighthearted always helps sometimes too.
I completely agree. I've really had to learn to be mindful of what I'm putting into my body, both what I'm taking in as far as funny shows versus news. And I've also had to learn to be very mindful of food that I'm putting into my body as well.
Yes.
I feel so much better. I've learned when I watch what I eat and I eat nutritious food rather than just taking all my COVID stress out on sweets and carbs and all of those things. I've also totally related to your comment about working from home and realizing that when 5 o'clock comes, that's the end of my work day and it's time to focus on my family. I really did find myself at one point working, until midnight because I was working from home. Yeah. So that's such great advice. And I also have to share with you guys that putting on a t-shirt, doing my hair, doing my makeup today, wearing earrings for the first time. I can't tell you how long. That made me feel so good. So sometimes it's just the little things that we maybe aren't doing anymore that we don't even realize really boost our mental health and make such a big difference. Thank you so much for sharing all of that with us.
I had one more thing, if you didn't mind.
Yeah.
I know we talked about a lot of positive things that we do. and because people are watching, I really want y'all to know that we are not always okay. Like, we are here, but like, these are things that we have taught ourselves to do to get back. Like, this is like, and I don't want to speak for everyone, but this is a good day. Like, we have gone through so many stresses, so many trials, so many doing it wrong. Like, I probably tried breathing and I'm like, it wasn't for me, or someone else wanted to, like, it does, you find your thing.
Yeah.
And if you haven't found it yet, it's okay, because you're going to, you just keep trying. But I just want people to know, and if you don't feel like trying as much today, to do it, as long as you woke up. And I make that post kind of often. If you woke up today and that's all you did, I'm proud of you for waking up, because that's okay. We don't all have it every day. And I would love for everybody to find their own personal 3 things, and find 5, 6, find a plethora of things, do whatever it is that works for you. But if you haven't, you're not behind the curve, you haven't done anything wrong. If all you did was wake up and wear pajama pants and go downstairs. If you didn't go downstairs, if you watched Netflix and you watched the same show you said you weren't going to watch again, that's okay. I've done that. That's me. I'm going to watch the same show again, probably tonight. I promise you. So it's okay to not be okay. And I don't want to have people feel that, like, oh, they have it so together. We don't. We do not have it together. My kids are literally itching to come downstairs and find my last nerve. Like, I know they're looking for it right now. They're making plans to find it.
That's such a good point. And to be transparent, one of the things that I've had to do to be mindful of my own mental health is I had to start prioritizing my physical and mental health. I realized that my priorities when I left the house were like work. That's pretty much it. And I was putting everything else aside, limiting my social interaction because of the pandemic. But I have realized that I need to prioritize my mental and physical health, and I've needed to see a doctor for medication, and that's okay. So I'm so glad that you brought that up, because that is definitely something that I've had to do, and I suggest that everyone does to safeguard their mental health is to see a physician when you need to, and make that a priority.
And I really like what Marcus said. It's okay to not be okay. It really is.
Yeah, not every day is going to be a good day. The thing is that, we just, tomorrow will be different. We got to end it with that thought at least,
I would like to give a special thank you to each one of you panelists that joined us today for sharing your knowledge and your personal experience. We all have a role to play, and we invite individuals, communities, organizations, and thought leaders to join us in our efforts to create long-lasting changes in mental health equity and to prevent suicide among underrepresented communities. As a health organization, we will also continue to speak out about the inequities in access to healthcare, and especially mental health, for people of color, and to advocate for ending these disparities. And we will continue to encourage all Americans to take care of their mental health during this very traumatic time. Thank you for joining our discussion today. For additional resources and to learn more about what AFSP is doing to address minority mental health, please visit afsp.org/minority mental health. You can also find more resources related to mental health and COVID at afsp.org/COVID-19. Thank you again for joining us today.